My question is embarrassing, but will I definitely have a bowel movement during delivery?
Well, it's not, I mean, the feeling when the head is coming through feels like a big bowel movement. So it's very common that women express it that way. And sometimes you do have a bowel movement. But the nurses and the doctors are ready for that. It happens all the time. Boom, boom, boom. They clean it up. It's gone, you know. So it's not a bad idea to speak to your midwife or obstetrician when you go into labor and say, are there things I can do that can help me to have a bowel movement, you know, during labor? So by the time I'm really at the pushing stage, I'm already cleaned out. And so there's less of a risk for that. And by the way, after you have the baby, you very much want to take laxative. You very much want to talk to your doctor about getting on something, or your midwife getting on something, so that, because it's sore down there and you do not want to have to deal with constipation on top of everything else that you're dealing with. So an ounce of prevention is worth a pound of cure there. But I want to tell you one more thing, not about moms pooping, but about babies pooping, because sometimes as they're coming out, or even during the labor process, the baby does get a little stressed. Especially if the cord is getting compressed and they're not getting quite as much oxygen as they need to get. And they can poop their meconium, which is this greenish, blackish, sticky stuff that they have in their intestines. And so you might hear the health professionals say, there's meconium in the fluid, which means that the baby has pooped already. Which doesn't mean that there's a problem, but sometimes is a sign of a problem, so they'll take that very seriously.